Welcome to the only show about the system by people who lived it. I'm Lawrence Bartley.
I knew I wasn't going to get any help and I wasn't going to get any better. I felt like I was going to die in jail.
He made me an offer. If you can stay out of trouble and leave that thug life alone, I will teach you how to paint.
I developed a skill set to build companies that I now use to dismantle them. We are removing the financial incentives to lock people up so we can get people out.
As anyone who's been on the inside will tell you, getting health care can be rough, especially if you have a mental health issue or struggling with addiction. As you'll see in this next piece, one effort to provide health care at a lower cost has stirred controversy.
I have exercise bands. I try to stretch it out as far as I can, and I do about 30 of these. This is helping my shoulder out, my nerve damage throughout my arm.
Doug Buchanan lives in constant pain. In November 2016, a spinal infection left him nearly paralyzed, and he has slowly been regaining mobility ever since.
All my medical records, oh my gosh, I've tried to save the best of my ability. And I started out with one here, and this is all my monthly pain medications to this day.
How he got this way is currently the subject of a lawsuit in federal court. He had been in a serious car accident and was still recovering when he wound up in jail awaiting trial for a larceny charge.
When you first went to jail, did you have any idea who ran medical there?
No, ma'am. I never even knew or heard a name of Turnkey until after I got away from the jail.
Turnkey Health Clinics is a private company that handles medical care for jails. Medical records show that when Doug started to experience severe pain, he looked to Turnkey nurses for help.
First day I got into the jail, I knew from the time I got there something was not right. They gave me a daily medication, 1 tablet of naproxen. By day 6, I lost feelings in both arms, and every day it was a little worse, a little worse. I asked to see a nurse, I asked to see a doctor.
Were you able to talk to anybody, ask for your family to try to intervene and get help?
On the video call, I asked my brother, I said, Stan, I said, look, they're not going to get me any help.
Oh, God. Hey, Stan.
What's up, man?
All right, man.
Man, you look like you're beat up, man. What's wrong?
Man, I'm in bad shape, man.
Huh?
I'm in bad shape. I can't move my neck. I can't lift my head. I'm all messed up. I've tried to see the doctor every day since I've been here. They put me off and blow me off every day. I can't even use my left arm. I'm just about to use. I'm just about to lose the use of my right hand and my right arm. So I'll be a total freaking invalid. I gotta change hands. I can't hold this arm up no more.
I felt like it basically was my last chance for a cry of help to somebody who knew me.
All right, I love you, Stanley.
I love you.
Bye.
Bye.
About day 11, I knew I wasn't going to get any help and I wasn't going to get any better. I felt like I was going to die in jail. When I finally urinated on myself,
Medical records show that Doug's heart was racing and his blood oxygen levels were dangerously low. A Turnkey nurse called the off-site doctor again. Only then did he order that Doug be taken to a hospital.
let me take my shirt off and show you guys. Okay.
Doug was rushed into emergency surgery for an infection that had developed between his brain and spinal cord. The doctor who operated on Doug wrote that it was the time spent in jail, with his condition going unrecognized and untreated, that led to his near-total paralysis.
I didn't know if I was going to be able to walk again.
Doug sued. The case against the doctor who worked for Turnkey is ongoing, but an appeals court said that any negligence could not be linked to a specific company policy, so the case against Turnkey was dismissed. Turnkey says it provides quality care for the more than 20,000 people housed in jails where the company has contracts. But our reporting unearthed company practices and policies that have endangered people in jail. We teamed up with The Frontier, a publication in Oklahoma, to look into Turnkey. The company's pitch is simple and attractive: good medical care for less money.
So Turnkey promises to keep costs down, and one of the ways they do that is they promise to send fewer people to the hospital. And I'm looking at some bid documents from a county in Texas where Turnkey won the contract.
They're saying, oh, we reduced hospital stays by 77%. So that means they're sending fewer people to the hospital. But that doesn't necessarily mean that they didn't need to go.
Another way Turnkey cuts costs is by staffing jails with less qualified nurses who aren't trained to assess illness. Turnkey says that more qualified nurses and doctors are on call all the time. But what happens when the staffer in the jail doesn't know to call for more help? That's what happened to Marconia Kessie.
So Marconia was in jail in Cleveland County.
He was overdosing on drugs, and the Turnkey medical staff at the jail thought he was faking.
Yeah, he's seizing again.
Marconia was left in a cell for hours until he was found dead. Turnkey settled a lawsuit with the family for an undisclosed amount. Marconia's was one of dozens of deaths that have happened under Turnkey's care. Even some law enforcement officials have sounded an alarm. We obtained an email from a sheriff in Texas who was voicing concerns about people in the jail not receiving proper medical attention, especially people struggling with their mental health. Turnkey's medical director said in a statement that they provide the highest level of care for the client's budget. Jails are often on the front lines of the mental health care crisis. That makes it especially dangerous if medical staff at the jails aren't properly trained. In November 2022, Shannon Henchett called 911. Shannon was a mother of two. She ran a popular bakery in town. But for weeks, her mental health had been fraying, and the 911 call was a sign that she needed help.
Shannon, you're under arrest.
I'm not under arrest.
You are.
I will be in here until this store closes. No, ma'am, please tell them. Oh my God! Oh my God! Please!
Stop.
No, please! It's on video, please! No!
She was arrested for improper use of 911 and locked up in the county jail, where medical records show her condition quickly got worse. Turnkey nurses noted that she was lying naked on the floor of her cell, incoherent, talking to herself. It took 10 days before an off-site doctor consulted on her care. Shannon's family had hoped that she would be transferred out of the jail and into a mental health facility.
It was hell on earth. I sat here day after day, waiting for a text, calling people, asking people. Nothing's been done again. We're still trying. And it was heart-wrenching, terrifying, nauseating. Just a sick feeling. I just had a feeling
that something was going really wrong.
Normal Police Fire and MSTAT, Stephanie, help you?
Yes, ma'am. This is Lieutenant Moore at the jail. Can we get MSTAT started this way? CPR in progress. She's not responding, unconscious, with no pulse.
the evening of the 7th, she was to be transported for treatment the following morning. And she passed away that night.
Who do you hold accountable for her death, and who do you blame?
Number one, I blame Turnkey Health. Flat out. Look at all the deaths.
Shannon's family filed a lawsuit against Turnkey and county officials, alleging that Turnkey's business model gives it a financial incentive to deny care. The company did not respond to our questions about Shannon's death or the lawsuit. In court filings, Turnkey's lawyers argued that the lawsuit failed to reach the required standard of evidence because Turnkey's actions hadn't caused wanton infliction of pain and weren't repugnant to the conscience of mankind.
This was my girl's place of business. This is where she loved everybody in Norman, and everybody loved her. She used to have a sign that said the Cookie Cottage. She sold out every day that she was open. Very proud of her.
I'm so tired of people being looked down upon because they have mental health issues. No one would have been thrown in jail if they had cancer. I'm a cancer survivor too. But people are being thrown in jail and into horrible situations every day because of mental health problems. But anybody can have this happen to them. So everybody better just say, but for the grace of God go I.
Bianca Tylek is a woman on a mission. The ex-banker and Harvard-trained lawyer is taking aim at those who profit off of mass incarceration. You built this nonprofit that's literally built to take down the prison profiteer industry. Can you tell me a little bit about that?
Absolutely. So Worth Rises, we are a national criminal justice advocacy organization that works to challenge and dismantle the $80 billion prison industry. We are also, working to end the exploitation of people who are incarcerated and their loved ones. And so whether you think about, something as simple as the cost of a phone call, this is a major industry, and I know folks inside know that, but it's time that folks on the outside really understand that. An industry that is so offensive it cannot advertise must use fear-mongering in order to hide its interests and boost its business. And that's what the prison industry does, right? It convinces us all that, that we are in constant jeopardy, our safety, even though that might not be true at all. And so really elevating that truth, as well as changing the policies that allow these corporations to do what they're doing, and for the public agencies like prisons and jails to partner with them in this type of exploitation, and challenging the corporations themselves, holding them accountable and making it clear that you won't be able to do this to our communities anymore.
Your work sounds like uniquely financial. Where did you learn the skills to do it?
I spent the first part of my career on Wall Street, where I sort of joked that I developed a skill set to build companies that I now use to dismantle them. After being on Wall Street for a number of years, I left and went to law school. And so even when I was on Wall Street, I worked with youth that were marginalized in different communities in New York, youth who had parents who were incarcerated. I knew that I didn't really have this big interest of litigating in courtrooms, but I wanted to understand the system that I wanted to implode. The way to think of our work is just quite plainly, we are removing the financial incentives to lock people up so we can get people out.
Some folks might say, no, well, it's a free market. These companies provide a service, so why shouldn't they get paid for the service they provide? What are your thoughts on that?
In some of our campaigns where we are actively fighting to make communication in prisons and jails free, there's nothing about a prison environment or a jail environment that is actually a free market, because who decides are the correctional administrators and executives. And so by nature, you actually have a captive audience, or what we call locational monopolies, where the people who actually pay for the service have no say in what service they use. And so these kind of examples, there's a multitude of them throughout this industry.
How does that play with the fact that some of these companies that you go after, they push a device, a tablet, and there's incarcerated people who say, in my facility, we have a limited amount of phones. We have to compete to the phones, to get to the phones, and sometimes it causes conflict, where if I have a phone capabilities on my tablet in my cell, then I don't have to compete. I could reach out to my loved ones. So how does that play with what you're doing?
I think that there's no doubt that we all support more technology in prisons and jails. Prisons and jails have trailed us in the free world in terms of technology. That being said, what we shouldn't be doing is allowing the companies that have preyed on our communities historically to be the ones to bring that technology in. So if you allow the person who created the problem to be part of that solution, they will find you a new problem. And that's exactly what's happening with tablets. I try to tell people inside who have not used email on the outside, who've been down for a long time, nobody pays for email in the world, period, except for inside of prisons and jails. That is a ludicrous concept, right? The idea that charging people in West Virginia 3 cents a minute to read books that are free in the free world, not just at the library, but literally digitally online, right? From the Gutenberg press. The idea that they're now selling movies and shows that also you can pay per minute to watch, or even if you can rent the show, it's $10. Or I saw an album go on a paid tablet for $46. What album costs $46 in 2024? And some systems will give out the tablets for free, right? And then I have to listen to correctional administrators tell me about how, because we got the tablets for free, we had to let them charge some other crazy fee. That's just not how negotiation works. You don't give up one fixed cost for perpetuity of exploitation.
So what makes you think you could win against these multi-billion-dollar companies?
Audacity.
Audacity.
I rarely pick a battle I don't think I can win. I think that these systems have rarely been challenged. But actually, there's a lot you can do, even within the parameters of capitalism, that threaten a company. And because I spent the first part of my career helping companies essentially plug the holes of their vulnerabilities, I sort of also know how to poke at them and how to exploit those vulnerabilities.
All right, now here's a big one. All right, you ready? What is your biggest victory on behalf of incarcerated people who are probably watching this interview right now?
I think our biggest victory is probably what for some may seem like the smallest. And that is access to simple and free communication. We're talking about 2 billion additional call minutes that people have had with their loved ones simply because calls became free. This is when I start getting the calls of my autistic child is speaking again because she could speak to her father who's incarcerated. Or I got to participate in my daughter's surprise birthday party for the first time ever. Or for those interested in what this means for broader society, I really do believe that in the next 5 to 10 years, communication in prisons and jails will be free everywhere.
Life inside can sometimes feel like being stuck in a cycle. As Rafael Rodriguez found, sometimes it takes something or someone special to break you out of that.
When I met my artistic mentor, my life was crazy. I had been acting like a wild horse, roaming the countryside with no respect for life. One result was a 675-mile transfer from a federal prison in Kansas to one in Virginia. It was my 3rd prison in 8 years. As I walked with 30 others into the Virginia prison, I could see the anxiety and curiosity in some of their eyes, but I was numb to these feelings. I was raised inside institutions, including foster care, group homes, juvenile detention, Rikers Island, New York State Prison, and in 2007, the federal system. 2 weeks into my stay, I got sent to solitary. When I returned, I had a new cellmate, Memo. Once Memo was sure that I was not a rat, we began to get acquainted. The main thing we had in common was art. He had a 20-year head start in painting and drawing, so I asked to be a student. He told me no, that I wasn't ready because I was always involved in prison drama. One day, I went to the art room for supplies. Memo told me to paint an image he picked out of a fishing magazine. A man sitting on a canoe on a lake with his back turned. I didn't know it at the time, but he was testing my oil painting skills, and I'm proud to say I passed. He didn't say much, just, at least you know something. Still, Memo's approval meant everything. I say this because when he paints, his colors dance around each other in harmony. Memo didn't take me on as a student until a year later. I continued to act like a wild horse. After I was involved in a fight, Memo pulled me into his cell. He asked me if I loved art. I said yes. He made me an offer. If you could stay out of trouble and leave that thug life alone, I will teach you how to paint. He explained that painting requires a clear mind. One way I could clear my mind was to walk away from trouble rather than run towards it. Where I once painted exactly what was in front of me, Memo taught me how to draw from inside with emotion. I began to understand how oil painting mimics parts of life. The same way a single brushstroke can throw an entire painting off, I needed to admit that I had always been a reactionary person. It was Memo who taught me how to pause and think about what I might lose before making another bad brushstroke. And that's how my mentor saved my life through art.
This episode made me think about my friends who got sick when they were incarcerated and couldn't get the help they needed. I know there are medical professionals who do their job as best they can in difficult situations, but I also know that when I was inside, staff made sure that when it came to our health, we knew one basic rule: sick call is for emergencies only, except sometimes that's too late. I know one person who complained so much about the pain from his hip replacement that they sent him to lockdown just to make him stop. He eventually had to get his hip replacement replaced. I know others who did everything they could to stay healthy and fit. One dominated the prison soccer field, the other lifted weights like he was building an impenetrable fortress, rep by rep. Both of them had pains and symptoms that didn't get taken seriously enough by medical staff. We'll never know what might have happened if they did, because they died in their cells before their sentences were up. Sleep in peace, my friends.